The Minister of Health, Dr. Osasie Ehanire, has launched the first phase of 13.77 billion naira funds disbursement for basic healthcare provision to states through the National Health Insurance Scheme Gateway. Ehanire, at a news conference in Abuja, said NHIS will disburse 6.5 billion naira of the 13.77 billion naira to 15 states, including the FCT, which have met the eligibility criteria as at 15th February. He said that the first tranche disbursement of the basic healthcare provision funds will be released to state social health insurance agencies by the NHIS.
The fund was finally appropriated in 2018 fiscal year to commence implementation of the program, thus demonstrating the political will of this administration to provide the much-needed health services to Nigerians, especially to the poor, especially to the rural, and also to the vulnerable populations. The commitment was expressed by the President himself in his speech at the 2019 inaugural of June 12 Democracy Day event, when he said, in quote, "We will accelerate investments in primary, secondary, and tertiary healthcare programs and interventions and infrastructure," end of quote. Today witnesses the first time in the history of Nigeria that the federal administration makes money available to state governments to pay for health care for her citizens.
Professor Mohammed Sambo, Executive Secretary NHIS, said the country had taken a giant step towards the attainment of universal healthcare coverage. Sambo, while appreciating the President for his political will and courage to commence implementation of the BHCPF, said disbursement of the funds will bring healthcare within the reach of indigent and vulnerable citizens.
At February, the National Steering Committee of the Basic Healthcare Provision Funds has slated 15 states and Federal Capital Territory as the states that have met the criteria for the disbursement of this amount. One of the criteria is the establishment of State Social Health Insurance Agency, which is backed by an enabling law, with the staff fully deployed into the agencies. The second criteria is to ensure that each state that is benefiting has opened a bank account, a TSA account for the agency. And thirdly, they must have provided operational funds, which is serving as a counterpart funds for the states. And based on the analysis by the National Steering Committee, the following states were adopted, and they have already received their allocations today. Edo State has received a total of 301,586,846. Katsina State has received a total sum of 638,968,221. Yobe State has received a total of 270,178,208 naira. Delta State has received a total of 394,210,710 naira. Lagos State has received a total of 672 million naira, 47,446 naira. Adamawa State has received a total sum of 342,755,327 naira. Kano State has received a total sum of 948,000 948 million naira, 512,911 naira. Anambra State has received a total of 338,943,386 naira. Kaduna State has received a total of 552 million naira, 887,647 naira. Imo State has received a total of 301,716,779 naira. Bauchi State has received a total of 530 million naira, 180,706 naira. Bayelsa State has received a total of 116 million naira, 580,339.93 naira. Ebonyi State has received a total of 230 million naira, 22,330 naira. Oyo State has received a total of 449 million naira, 214,592 naira. Plateau State has received a total of 337 million, 137,315 naira. Lastly, Federal Capital Territory has received a total of 118 million naira, 166,187.83 naira. This is the distribution across the 15 states and the Federal Capital Territory, Abuja.